he and his team made me taller, 10 centimeter with LON method.
Right.
And I came here, Yerevan, to remove nails, 4 nails. And I had the surgery, and now I'm okay, perfect. And I will go back to my home, Japan, 2 or 3 days later. And I have some questions of the surgery, so may I ask you?
You're welcome to ask any question.
Thank you so much. Which is better, a classic method or LON method? Which is the better? How do you think?
Well, there's advantages and disadvantages. Ilizarov method is the most reliable.
Most reliable. So,
and with a very low complication rate. Because if we have infected wire, it's not a problem for us. Lengthening over the nail or lengthening and then nailing, LON or LATN methods, they decrease duration of frame application.
Yes.
It is much more comfortable.
Yes.
And it's shortening the time of whole procedure. But there is a risk of infection. Like any surgery have risk of infection. It's close to zero, but it's never zero. That's why if you don't have shortage of time, you preferably do classical Ilizarov. If you want to make it shorter, then available is LON or LATN technique. I have a representative of one very solid company, and we made agreement that soon we will start apply fully implantable technique.
Oh,
I mean the rod that you put a magnet or this and self-expanding rods. So all these 3 approach will be available in Armenia soon. But today we have classical Ilizarov and a combination of frame and nail. Advantages and disadvantages I told you in general.
Thank you.
You're welcome.
When can patient have the fully internal approach? 1 year later, or?
I hope it will take shorter. I believe, I hope in summer we will start suggest that technique to our potential patients.
This year?
Yes.
Oh.
I'm not sure.
Yeah.
I'm not sure, but we both sides and company and our center is very much enthusiastic to start this new approach in leg lengthening treatment in Armenia.
I hope. I also hope.
Well, thank you. Thank you, my friend. That depends to approach. Some surgeons saying that there's a no need to remove.
No need to
remove. Okay, but I believe that it's worth to remove it because bone marrow is very important thing for blood production, for immunity production, okay?
Okay.
And the space of bone marrow is busy with a frame, with a metal. So and when metal does nothing, when bone heal, why should we keep that foreign body inside patient? That's my approach. But other doctors saying you can live with implants
forever.
forever.
Okay.
I cannot tell you exactly the numbers now. I think nearly 70, I think.
70.
Yeah. I know recently we just counted only from Japan.
Only from Japan.
Only from Japan, we so far operated on 16 patients. 16.
16, yes.
Yes. And it was about 12 from United States. Well, altogether about the number I mentioned. Okay. The worst complication can happen. It's anesthesiological death.
On operation.
On any operation.
Yes.
The worst complication can happen. But people do surgeries, okay?
Yes.
In our field, I think the worst complication is implant infection.
Implant infection.
When we do nail, and we had recently one case of complication, but we successfully deal with it. That's affect duration of treatment, but it didn't affect final result. Yes, but it is serious complication. So patient, any potential patient should know that anything is possible in surgery. So if he or she can be happy with the height that he or she has, let them be happy. But if they have a significant psychological problem of being short and cannot realize them as a person in personal life or in professional field, we are here to help, but we are not gods. We are doctors. So anything can happen.
So no patient you had got amputation?
No.
No patient?
No, thanks God, no.
Okay.
No, we never had amputation. We had a nerve palsy that is spontaneously healed because we didn't interrupt the nerve. It was a big hematoma was pushing that, and that was the cause of palsy. It heals. We had a case of affected implant nail. That's the most bad complication so far we had, and nothing more. Thanks God. One of our first patients, after lengthening, he represent patella baja.
Patella baja.
You know what's that? It's when your patella is going down because of lengthening. That was a combination of his ligament individual characters and the level of osteotomy was done a little proximal. So we had this bad complication, and I suggest to that patient for him to come and to be operated, and I was ready to invite a doctor from US, but he never come. He never come. I think he did that operation in Japan. Yes, I remember that was many years ago. But the majority of our patients, like you, are happily returning home to their daily routine and feel happy, tall and happy.
Yes,
Yes, like
I
you.
got taller and I'm
Yeah.
happy. Yes, of course.
It depend of technique, depend of method. Okay.
A classic. No?
Yes, classic Ilizarov. We put a patient on legs and stimulate full weight bearing. Frame is rigid enough. Okay. When we start bone training and removing the frame, we limit physical activity for about 5-7 days, then slowly increase, and recommend patient be careful very much for about 1 month. 2 months is a relatively carefulness needs, so he needs to avoid slippery surfaces, don't do anything stupid, don't jump from, okay, and 3 months later, no limitation, no limitation. He can do contact sport, karate,
like karate, boxing,
jumping from a parachute,
soccer,
anything. His chance to break a leg is the same that I will break my leg in the same situation. Okay? 3 months later. Now, when we do lengthening over the nail, we put 4 screws which are very strong, but nevertheless we recommend not to do to decrease physical activity, not to do anything aggressive, anything stupid, if you let me to say that. Avoid slippery surfaces, and sometimes walk with a stick, not because patient need that stick, but because he mentality needs to be stick, and stick shows people around be careful. So okay, generally about physical activity is that.
Okay, thank you for answering my questions. Thank you.
You are very welcome.
Thank you.
You are very welcome.
Okay, bye.
Bye.
Bye.